Hi, I am so elated to meet you in the program of 1 minute. We are continuously learning about tirzepatide. So, what are the indications of tirzepatide? So, when glycemic control is not achieved with metformin alone, then you can add tirzepatide. The most important would be there are 4 strong indications for administration of tirzepatide. 1. When somebody harbors atherosclerotic cardiovascular disease, I mean stroke, MI, unstable angina and peripheral vascular disease. Those who have existing atherosclerotic cardiovascular disease, to prevent the recurrence of these diseases, you should administer tirzepatide. And second, if they don't have atherosclerotic cardiovascular disease, but if they have risk factors for developing atherosclerotic cardiovascular disease, including systemic hypertension, dyslipidemia, obesity, microalbuminuria, family history of premature cardiovascular disease. So, when they harbor all these cardiovascular risk factor but not yet developed atherosclerotic cardiovascular disease, still you can administer GLP-1 and GIP dual agonist, that is nothing but tirzepatide, to prevent the development of atherosclerotic cardiovascular disease. Third, chronic kidney disease. How will you define chronic kidney disease? When somebody's eGFR less than 60 ml per minute, or in the presence of normal GFR but persistence of albuminuria more than 3 months after ruling out the reversible causes of albuminuria, then it is called chronic kidney disease. Sometimes you don't need to expect reduction of eGFR. Even albuminuria also may be a marker of chronic kidney disease when it persists for more than 3 months. In these patients, tirzepatide is strongly indicated to retard the progression of chronic kidney disease. So, apart from 3 strong indication, then the 4th indication would be the weight. When you have BMI more than 30, even in non-diabetic individual, it is strongly indicated to reduce the weight, because SURPASS 5 trial clearly demonstrated that in non-diabetic individual, it is able to bring down weight by almost 22.5% from the baseline. So, it is such an amazing drug. So, it is strongly indicated for reduction of weight. Then, if somebody has BMI 27 with one of the comorbid including diabetes, hypertension, dyslipidemia, then in these patients, and definitely for the sake of weight reduction, you can administer GLP-1 and GIP dual agonist, that is nothing but tirzepatide. These are the 4 strong indications for which tirzepatide can be administered liberally. Thank you.